Welcome to a special edition of Washington Week. We begin with the latest fallout from the coronavirus and the response in Washington. The World Health Organization raised its risk assessment of the virus to very high on Friday, just one level short of declaring a global pandemic. As fears have mounted, stocks have plunged. The Dow Jones Industrial Average dropped 350 points on Friday, or more than 1%. For the week, the Dow fell more than 12%, capping off the market's worst week since the financial crisis that began in 2008. This all comes at a politically charged moment. President Trump and his top aides are lashing out at critics. In Congress, it's on edge about a whistleblower report and whether lawmakers can come together on emergency funding. And Democrats, they are still searching for a standard bearer on the eve of the South Carolina primary in next week's Super Tuesday showdown. Joining me at the table, Yamiche Alcindor, White House correspondent for the PBS NewsHour, and Peter Baker, chief White House correspondent for the New York Times. And from Chicago, Yasmeen Abutaleb, health policy reporter for the Washington Post. President Trump named Vice President Mike Pence as the point person for the administration's response. This move is being questioned by Democrats and health experts, and the administration's early decisions are already under scrutiny. As Yasmeen and her colleagues wrote in the Post, a whistleblower is alleging the Department of Health and Human Services sent, quote, more than a dozen workers to receive the first Americans evacuated from Wuhan, China, the epicenter of the coronavirus outbreak, without proper training for infection control or appropriate protective gear. Yasmeen, was the U.S. government prepared for this crisis?
I think a lot of criticism has come from the moves the U.S. government made a couple of years preceding this crisis. John Bolton, the former national security advisor, had disbanded a unit within the White House that was set up to prepare for this kind of thing back in 2018. So when this came, there was no immediate clear leadership as to who should be in charge. You do have top health officials who have been involved in other responses. Health and Human Services Secretary Alex Azar was in the Bush administration during the SARS outbreak. Anthony Fauci at the NIH has been involved in several outbreaks over decades, but there was a lack of leadership at the beginning, and a lot of that came because there was the disbanding of that unit within the White House and the pandemic preparedness, people whose sole job was to prepare for an event like this, and cuts to the CDC that did global monitoring to detect outbreaks before they spread out of control.
Yasmeen, do officials who are there feel like they can speak out and tell the truth to the American people, or do they have to go through Vice President Mike Pence?
I think there's still a lot of confusion with all the events of this week and the change in leadership. We do know from our reporting that now all communications regarding the outbreak and the message to the public do need to be routed through the vice president's office. Some people say it's just to make sure the administration has a coordinated message, because on Tuesday we saw conflicting and messages that were sort of overlapping and conflicting with one another. But it still remains unclear whether scientists and top health officials are going to be able to speak freely, or if the administration wants to take a different posture because of the way the markets have reacted this week.
Yasmeen, stay with us. Peter, to that point, the significance of the market collapse.
Yeah, it's big because, of course, first of all, economically, a lot of people are dependent on the supply chains, on China in particular. That has been a source of a lot of material and products that we use. Apple alone, I think, assembles the vast majority of its products in China. That's a big part of the American market as well. And it's big politically. The President of the United States is running for re-election largely on his record of keeping the economy going strong. And if that seems to begin to pare back over the weeks and months to come, that undercuts his message, something he's, I think, acutely aware of, particularly in private when he's talking with his aides with great anxiety about what's happening.
Yamiche, as we went to air, President Trump in South Carolina at a political rally, his aides like Acting Chief of Staff Mick Mulvaney all day lashing out at critics, framing this as a political fight as much as a federal response.
That's right. The White House has been saying the Democrats are trying to use this to make the President Trump look bad. They've even at some point said that Democrats are hoping that the president messes this up, or hoping that this turns into a full-blown crisis so that the president maybe is hurt politically. But that said, this is a president who has always seen his political benefits and his political legacy tied to whatever crisis is going on, whether or not it's Russia interfering in the election or now coronavirus possibly infecting Americans. We know already through my own reporting, and I'm sure other people's reporting, that senior administration officials are already looking at economic things to do in response to the coronavirus. They're looking at tax cuts, possibly. They're looking at possibly pressing for interest rates to go down with the Federal Reserve. So what you see is the White House already trying to assemble both an economic solution for this as well as a medical and scientific solution. And when we talk about Yasmeen and others saying that there's conflicting issues here, the conflicting message was that the president was saying that everything's going to be okay, that there's low risk. And then you have the CDC and the World Health Organization, who are experts on this, saying actually that's not what we can say. What we can say is that this is high risk and people should get ready for what happens next.
Yasmeen, based on your reporting, what does happen next in terms of the federal response and what their read is on the spread of the virus?
Well, I think the virus has sort of entered a worrying new phase in the United States. Our colleagues reported today that California has confirmed another case of community transmission that's about 90 miles from the case that was reported earlier this week. So that indicates that you have community spread of the virus in 2 different places within California. And as you mentioned, CDC officials earlier this week said it's not a matter of if, it's a matter of when there's greater spread in the U.S. and that we will see more cases. So I think the question is going to be, how does the federal government make sure hospitals and local and state health departments are prepared? How are they going to scale up testing, because more people are going to need to be tested for the virus now? And how do they change the guidelines of who needs to be tested and how quickly you get people tested depending on the symptoms that they show, since those symptoms are very similar to a cold or the flu?
Peter, you're a scholar of the presidency. When you look at the decision President Trump made to put his vice president in charge, a political official in a re-election year, a campaign season, what does that tell you about President Trump in doing that versus putting in a medical professional?
Well, look, you need a leadership that goes beyond simple science, right? But the question is whether or not Vice President Pence surrounds himself with the people who understand the science to guide the decisions that he will help make in the days and weeks to come. President Obama put Ron Klain in charge of the Ebola crisis during his thing. Ron wasn't a medical expert, but he was an expert in making government work. He had been the chief of staff to 2 vice presidents and a long-time political operative who understood government. So the question isn't necessarily whether Vice President Pence has a particular medical background or not, but whether he surrounds himself by people and listens to people who do. Now, his own experience as governor of Indiana has caused some concern because of the way he handled outbreak of HIV back then. He said today on Rush Limbaugh's show that actually is an experience that made me more qualified, not less qualified, but he will continue to be controversial that they put him in charge.
And he was criticized for how he handled needle exchange in Indiana, correct?
That he was criticized for that. Now, there are people who say that was a moral issue for him, that possibly his religious views made him feel like he didn't want to have a needle exchange in Indiana. This is a little bit different because it's coronavirus, but there are a lot of people who are worried that Mike Pence might end up being the fall guy if this doesn't go well, that the president is already looking for someone to say, look, it's not my fault. I put Mike Pence in charge. This is what I'm going to do. And he didn't handle this well. It's not my fault. So that's in some ways the political calculation that could be there.
Yasmeen, what are you hearing based on your reporting about how the congressional briefings went on Friday and whether Congress is going to be able to come together on an aid package?
I think one thing that we've seen this week, Secretary Azar was on the Hill several times this week being grilled by lawmakers about the response and the supplemental request that the administration sent to Congress on Monday. They asked for $2.5 billion to respond to coronavirus, and about half of that would be reallocated from other resources. It seemed both Republicans and Democrats agreed this week that that was just not enough money, and that something more along the lines of $4 to $8 billion would need to be appropriated. So there does seem to be bipartisan agreement that more money is needed. But then we also know on Friday that public health officials were questioned about this whistleblower report, and are they adequately preparing staff members for this, and were protocols broken when these staff members went to receive the first passengers returning from Wuhan?
Peter, back to the market for a moment. Yamiche mentioned that the Trump administration could pressure the Federal Reserve for interest rates cuts. Are you hearing the same, and do you expect emergency measures to be taken?
Yeah, I think it's possible. I don't know how much that would actually stem the tide. I mean, what the markets are concerned about go beyond interest rates and a little stimulus from tax cuts at the moment. That's the uncertainty that they're grappling with. What is this going to mean, not just in the next few days, but what's it going to mean down the road? China is such a big factor in our economy as well. It's the second largest economy in the world. If they are shut down to us on a long-term basis, a slightly smaller interest rate might not be enough to counter that. But what the president wants to do is show confidence. He wants to build, economic, vitality going forward. And these are possible signs in order to do that, even if they might not substantively have the kind of effect people would want.